So it's important for us to identify the need. The need is clearly there. And some of the things that we have incorporated is to have signages. So we have posters about mental well-being and pregnancy in our clinics that are there for people to see, offer privacy for a conversation. We have started incorporating some aspect of mental well-being into our pregnancy preparation classes. With the psychologist on our team, we actually offer sessions, group sessions on wellness, which is slowly picking up. And then those who actually have a need can directly fix an appointment, even if they don't tell us. So it's important to incorporate this personnel into our team. And I think therein is a challenge, because we need to capacity build and identify people who can get incorporated. But at least large obstetric practices should have somebody who is trained in this area and get incorporated into the team. I strongly feel that as obstetricians, we need to do a basic skill upgrade to do a good initial assessment, because by default, as obstetricians, gynecologists, we are, in the context of India, the GPs for our pregnant women. They do look to us as the primary caregiver, and there is a degree of trust which is built over a period of months, which is an advantage that no other medical professional tends to have across an access to women. And if we don't leverage that to help them in their mental health issues, I think we are doing them a big disservice. So, but we are not trained. Nothing in our curriculum trains us to identify or help women with, identify women who need additional assistance. And so that's an area where I'm very interested, and hopefully we will have some additional training going forward, and then have a clear referral pathway. Who is this person that you're going to send? And so that there isn't a loss between your sending them out to the clinic, they're then not able to get an appointment, they don't go to see somebody, or they see someone who's not speaking the same language as you. So those things also have to be incorporated. And last but not the least, because we are increasingly seeing more and more women who are already on medication for mental health problems, I think telling them you have to go off medication and then only come back to us is no longer valid. And we are not familiar with some of the more recently giving medications that are prescribed. So collaboration between the mental health expert and the obstetrician should ideally begin pre-pregnancy, so that we are also comfortable and we are able to take this woman through. And it's not important to tell them right at the start that you cannot breastfeed the baby, because you don't want that anxiety to start at 10 weeks or 8 weeks. If and when they can't feed, we'll deal with it closer to that time. But right now, there are other anxieties that she has, which we need to allay and take her through before the fact that feeding cannot happen. Because I'm saying this because I've had women who have come and said, no, is there no way I can feed my baby? Because that's important for them and we cannot discount it completely. So I think if we are able to keep an open approach, if we have an integrated care and we upskill ourselves so that we can listen to these women, we will do a much better job of giving them a holistic supportive care during their pregnancy.